So yes, I'm delighted to hand over the next presentation to Dmitry Kaminskiy, the managing partner of the Deep Knowledge Group, who's doing phenomenal work in many, many different areas, and of course has been incredibly involved looking at what's been taking place in terms of COVID-19, and will be taking us through a global analysis of the economic, societal, and health stability of regions, 200 regions globally. So over to you, Dmitry. Thank you.
Good afternoon, everybody. Thank you, Tina, and thank you, Richard, for your kind words. We at Deep Knowledge Group are very much happy to support this initiative with this conference. We think it is very important. It was extremely efficient for different nations to share their experience and positive examples, how they're implementing progressive solutions in preventive medicine and initiatives regarding health and longevity. However, now, considering this COVID pandemics, this is sharing of positive examples of experience of practical solutions. This is becoming even much more crucial. And now I will share my presentation. One second. So when in March 2020, it became clear that we are facing something unprecedented, really global challenge. We decided to assemble a team of analysts who started to develop big data analytical framework to analyze what different countries and regions are actually doing to prevent spread of pandemics and to tackle down consequences. And at the first iteration, first analysis was done in April. By the time we analyzed approximately 50 countries using just several tens of parameters, which were considered as major parameters. However, in the most recent assessment, we profiled and analyzed more than 250 countries and regions, literally the entire globe, using 140 parameters. And these parameters multiple different issues somehow related to COVID pandemics, but not particularly only on medical side. And the total, it gives us a big data analytical system with 35,000 data points. And through that, we actually succeeded to derive some interesting patterns. This is the framework. And you actually can consider that to some extent, this kind of like X-ray snapshot of what each country is doing on these issues related to pandemics, and both on quarantine efficiency, monitoring, healthcare system, risk management, government management, emergency preparedness, and so on. We are using mostly data derived from official public available sources such as World Health Organization or World Bank. But on the other hand, we are structuring this data for this big data analytical system. Actually, now it is already analytical dashboard. There's quite a lot of much more advanced solutions implemented just literally over the last several weeks. You can review this dashboard by this link. There is quite a lot of infographics and graphs which are giving opportunity to review this abundance of data, but in a simplified mode, so that responsible decision makers can actually, think about how to implement good, positive examples, solutions at the same time to avoid some mistakes. This work was quite well recognized by world media and by quite big number of government officials, including several ministers and prime ministers. As I mentioned, we're using big data. 140 parameters, and multiple times we were asked such question: what is the solution? What each country shall do to prevent pandemic? So what each country shall do, to cope with consequences, with economical consequences? And the answer is that there is no magical solution. In reality, what we understood after this several rounds, several iterations of this big data analysis on global scale, that country shall actually implement a good balance of all those 140 parameters it's impossible that, for example, to apply very strict quarantine just itself, because then it will damage the economy. On the other hand, if the country is not implementing any measures to prevent spread of pandemics, it's actually will damage the economy and the country even more. It can cause even political issues. So more of it, for different countries, it's impossible for one country just to follow one particular example for another country, because each of the countries, they're quite different, including, for example, in terms of their geographical specifics. For example, for Singapore, there could be no equal measures or patterns equal, for example, for UK, because UK, it's a bigger country, there's one big town, but there's a lot of other geographical distributions. So that's why for different countries, there shall be a unique formula, what in particular they should implement. Along with this project on COVID analytics, we also created, we profiled most active players in the COVID medtech ecosystem. And we created several infographic mind maps. We did also the same for UK COVID medtech ecosystem. There's quite a lot of companies, scientists, R&D centers. And again, we made infographic mind map. It is interactive. And for these interactions, we think that it's quite interesting and important, because again, some decision makers can understand who's doing what and how these interactions could be optimized in the sense that this ecosystem, anti-COVID ecosystem, could be accelerated. We also profiled H-Tech UK ecosystem. We think that this is quite important, that probably government and some other organizations shall support further development of this industry. It is quite well developed already in the UK, so there's 500 companies, multiple investors, and a lot of funding bodies. Again, it's became very clear that COVID pandemics are actually affecting most negatively all people. However, these companies providing practical solutions through modern technologies to support those people. And that's why, once again, we think that this particular industry, H-Tech, shall be prioritized more in the UK. Actually, in all other countries, but in the UK, there's a lot of opportunities for this. So here are 3 links by which you can review this, these 3 projects. 1 year ago at this conference, International Longevity Policy and Governance Summit, we presented this analytical report. So it was, again, big data comparison of 50 countries by 200 parameters each, with the idea to derive the best examples and the best strategies, how those countries implementing progressive projects in regards to preventive medicine or healthy longevity initiatives. And we've made several special case studies, for example, longevity in the US, longevity in Gulf region. This is our standard approach to apply a big data analytical framework to derive patterns. And we actually derived quite interesting patterns why some particular nations are actually achieving much better results in terms of not just life expectancy, but healthy life expectancy. And they're shortening the gap between highly and they're shortening DALI, disabled life years. Leader in the field is Singapore. Hong Kong are also doing quite well. We summarized these findings in this book, Longevity Industry 1.0, which was published 1 month ago. And in that book, quite significant part dedicated to longevity policy and governance. Several days ago, we launched second iteration of that big data analytical project, comparing more than 50 countries. And actually now it is in the form already of an analytical dashboard. You can review this project by this link. And it is using more advanced data science techniques, much more advanced visualization. There are more than 80 graphs, charts. Most of them are interactive. This is technological architecture of the system. So there's a lot of also geographical maps where you can see some particular comparisons and why, let's say, this provides interesting hints why some countries, again, achieving better results in terms of health life expectancy. So as I said, there's quite a lot of information in this dashboard. Many parameters are actually real time, so they're absorbing information from online sources and updating in real time. And this system will be systematically updated, but I will give you now quite interesting conclusions. What we found actually between analysis of COVID pandemics and this progressive healthcare and longevity initiatives in different countries. Because we think that such big data analytical systems actually will give additional opportunities for decision makers to make this shift from treatment to prevention faster, and as an ultimate goal to achieve this shift from precision medicine to precision health. For that big data analytical research on the matter of most progressive countries in terms of implementing technologies and solutions in regards to preventive medicine and initiatives regarding health longevity. So actually, we found that they have several patterns in common. So they are prioritizing preventive medicine. They are making focus on data science in healthcare, implementation of data science for healthcare. Most of them are having efficient GovTech solutions, e-governance. Apparently, all of them having quite a lot of activities regarding digital health and artificial intelligence. And at the same time, these countries having all these technologies and projects, they're having much better opportunities to actually implement national health longevity industrial strategies. On the other hand, we, through that big data analytical system on the matter of analysis of COVID pandemics, we actually saw that countries who succeeded by this time to tackle down this challenge the best, they actually, most of them also have the very same patterns. So from our point of view, most progressive countries will be capable to neutralize COVID pandemics. At the same time, most of them will have probably the best resources and basis to implement later on actual national strategies on the matter of health and longevity. And I think today, later we'll hear some very interesting examples from the speakers from United Arab Emirates, Japan, because those countries are actually doing quite well on both fronts. Thank you for your attention.
Thank you so much, Dmitry. As usual, incredibly comprehensive and incredible detailed analysis. We've got a couple of minutes before the next panel, so I'm just going to, we've had a couple of questions come through, and I'll just ask one to you, Dmitry, from Jose Cordera. It asks, which specific rejuvenation technologies do you think will first become commercial? And in 10 years and in 5 and 10 years, what is your prediction?
I think there are already such technologies on the market. I think there is lack of management, understanding what shall be applied and when, and in what capacity. And the key solution, I would say, the game changer will be good enough panels of biomarkers of aging and longevity. I think today we also will hear very comprehensive discussion on that matter. So my point is that there are already technologies capable slightly to rejuvenate your body. If you assemble them like 10 or 20 or 30 of them in one, let's say, blend, so they literally will be capable to regenerate at least for several years, or at least definitely to slow down aging. The problem is that doctors do not have yet enough understanding, not enough big data analysis to understand what and when shall be implemented for particular, for particular, even not patients, but I would say healthy people, because they may understand maybe a little better what should be applied for unhealthy people, but maybe it should be also considered what should be applied for healthy people to extend their health longevity.
Thank you so much, Dmitry.